Welcome to Flip Your Script, the Vodcast from the American College of Lifestyle Medicine that's all about clinicians redefining care through lifestyle medicine. My name is Dr. Padmaja Patel. I am the current president of the American College of Lifestyle Medicine, and I'm board certified in internal medicine and lifestyle medicine. We're thrilled to bring you the inaugural episode of Flip Your Script. In just 15 minutes, we'll dive into 5 key takeaways from leading experts and practitioners who are using evidence-based lifestyle medicine to transform patient outcomes. From practical strategies to success stories, this podcast focuses on the how of lifestyle medicine, empowering you to make an impact in your practice and beyond. For this special first episode, we're honored to have Dr. Michelle Thompson with us today. Dr. Thompson is triple board certified in lifestyle medicine, integrative medicine, and osteopathic family medicine. As the medical director for the Lifestyle Medicine Institute, she leads initiatives to put self-care at the heart of both patient care and employee health. She is transforming healthcare by incorporating programs like teaching kitchens, mindfulness workshops, yoga, tai chi, sound therapy, and more into her practice and community outreach. Dr. Thompson, welcome to Flip Your Script. I know you have strongly advocated for transforming the healthcare system by integrating lifestyle medicine at all levels. Why do you think it is important to include lifestyle medicine as a foundation of all healthcare?
Lifestyle medicine really is the core of the way human beings should just live their lives, right? We cannot argue the 6 pillars of lifestyle medicine: sleep, exercise, nutrition, substance use, stress management, and connection with others. This is something we all need. And so when you have this interdisciplinary team and you have this at the core of your healthcare system in the medical school level, the residency education, your support staff, nursing, occupational therapy, physical therapy, pharmacists, physicians, essentially everyone who is involved in patient care, you really start to embed it into the hospital system. So you're completely sprinkling it everywhere and changing the entire culture of the system, where it's normal to take good care of yourselves before you show up to take good care of the lives of all that we touch.
Very well said. And I'm sure there are many who would like to know, how do you make sure to integrate lifestyle medicine principles in every patient visit?
So for me, I really start every patient visit by essentially saying, how are you doing? What's going really well for you? And what are your struggles? How can I help you through them? And tell me about your sleep, exercise, nutrition, stress management, and substance use. Opening that in a 1-minute, 1-minute statement really gives them the idea that you want to hear how their life is, and you want to hear and celebrate their success, and also encourage them through the struggles and see how you can conquer those hurdles, those barriers that they may be facing.
Yeah, there's so much emphasis on whole person care, right? Everyone's talking about it. And I personally think that lifestyle medicine is the foundation for whole person care. What would you say? Do you agree with that, or you have any other thoughts?
100%, because it really touches on everything. It looks at, the whole mind, body, spirit approach. And that's really when we look at the mindfulness aspect and the mind body medicine, we have to be able to connect our mind with our body to know how to take good care of ourselves. Just because we have the education does not mean it's easy, right, Padmaja? For me as well, being very busy in the work that I'm doing, I have to really be that change that I want to see in the world. So I have to take good care of myself and implement that as I am moving into my day. So trying to really tell people too, we realize that this is not easy, not just saying, oh, it's easy to do all these things every day. Life happens, things get in the way, but can we come back to ourselves in that whole person, mind, body, spirit aspect and honor this only one being that we get to navigate this world with?
Beautiful, beautifully said. Question is, let me ask you this around a question about the interdisciplinary team members, which are kind of very integral part of lifestyle medicine care model. And I wanted to ask you, and I'm sure it will help our audience to understand, how do you collaborate with interdisciplinary team members to deliver this coordinated, integrated type of whole person care?
I think the big thing is to realize that no one person can do this alone, and it does take a team, and that everyone on your team is important to the success of the team, the patient, the community, everyone that is involved. So, really, just making sure that everyone understands that we each have a beautiful gift to bring to the world, and can we celebrate those successes with each other and empower our patients to really what we're trying to do is put them into the driver's seat of their healthcare so that they have all of the tools that they need to be successful. And so no, again, no one person can do that alone. So how can you pull all of these people together? And for me as a primary care physician, really just knowing that this should be the center of all primary care, whether it be family medicine or internal medicine, knowing that all patients who enter a primary care setting should have access to lifestyle medicine first and foremost. And then, making sure our specialists know, whether it be cardiology, renal, pulmonology, any specialty, endocrinology, that we can all work together. And so for us in a hospital institution, I mean, we make it known that lifestyle medicine is available across our entire system, which is very large, almost 100,000 employees, 43 hospitals, making sure that our patients have this access to lifestyle medicine so that the physicians who aren't aware of it or don't know how to do it can lean into our team, our lifestyle medicine team, to help to support them to have better outcomes for their patients. And so then those physicians who actually want to be more involved can come into our lifestyle medicine team and also administer these group medical visits and, lifestyle medicine assessments if they so choose. Because as you know, as well as I do, multi-specialties want to be lifestyle medicine board certified so that they can implement this. We have a pharmacist that does this, an occupational therapist who does this, our physician assistants, dietitians, multiple specialties, even occupational medicine. We have some that have implemented that, endocrinology, etc. OB-GYN is another really big one. So really just involving the entire team and creating awareness inside of the system and the community.
Yes, yes. I think you highlight a very important point, which is obviously, lifestyle medicine is well suited for primary care, but it works equally well for specialty care. And in addition, even sort of bringing into interdisciplinary team members into training into lifestyle medicine. So truly delivering what we call as a team-based care.
Yes.
So great. I know when it comes to lifestyle medicine in medical education, you have spearheaded efforts to place lifestyle medicine at the core of medical education, from medical school to residency and beyond. How does focusing on lifestyle medicine and medical training help doctors feel more satisfied and prevent burnout?
It's a huge passion of mine. I've been doing this work in physician well-being for over a decade. And when I see the medical students and the residents implement lifestyle medicine and understand lifestyle medicine and put that into their own life, they really start to come back to themselves and realize that they first need to put on their oxygen mask before they go out and take care of others. And when we do that, and we have this in our first semester of medical school at the University of Pittsburgh School of Medicine, and I will tell you, at Monday, we had only one student who knew about lifestyle medicine and mind-body medicine before we started the lecture. So at the end, 25 of the students then know, because we have little, sections that they're learning in. But then they realize the importance of this taking care of themselves, and they won't maybe lose themselves as they enter residency. And so putting it into the residency program is also important, because if you didn't catch them at the medical school level at the very beginning, then you can get them at that level to come back to themselves. every learner that I take care of and that I train, they are always happy to see that they can care for themselves while they're caring for others. And I think that's so powerful because, as you know, back in when we were trained, we didn't sleep, we didn't eat, we didn't go to the bathroom. We discounted all of our very basic self-care needs to care for others. And I think
Yeah.
that's a very big shift that does transform the healthcare and the system and the community and the understanding and the awareness when we start to say, I need to care for myself so that I can care for you. So I'm very passionate about medical student and resident education. We actually have it in family medicine, internal medicine, and physical medicine and rehab. My goal is to have it in OB-GYN as well at UPMC. But, I think that if all the physicians come out understanding this, they continue to be that ripple that changes the world and putting lifestyle medicine out into all the lives that they touch on a regular basis.
Yes, yes. And I think this is such a relevant topic, knowing that almost 62 to 63% of physicians experience at least one symptom of burnout. So, this is such a critical message that you're doing, and it's an incredible work. And I really admire all your efforts. But what tips do you have for, say, for example, educators who want to add lifestyle medicine to their programs?
Being brave and knowing that anything is possible. I think sometimes for me, it's overwhelming trying to take a gigantic system and shift it. And I've been with the system for 20 years. So the shift didn't start to happen until probably 5 or 6 years ago, where we got this awareness. Probably COVID was a big portion of when we realized that we're all humans and we all need self-care and we're
Yes.
not robots, right? So I think never giving up, always knowing that we are all here, us that are doing it across the world to support you in your efforts and your mission so that we can be successful, because it is possible for all hospital systems, big or small, where you're located, whether it's in the United States and beyond. This past year, I was speaking at the International Lifestyle Medicine Conference in Saudi Arabia. So this isn't just in the United States. This is worldwide, where we're really transforming healthcare with lifestyle medicine really at the forefront. So not giving up, leaning into your peers, your colleagues who have been successful. We're all really here to help you. And the American College of Lifestyle Medicine has so many member interest groups that I have found very useful to help me to feel supported and not give up on my mission to truly transform healthcare.
Truly, it is a global movement, no question about that. Moving on to community engagement piece of lifestyle medicine, and I know your work highlights the importance of community engagement through initiatives like lifestyle medicine interest groups, shared medical appointments, and teaching kitchens. How do you believe community involvement is the key to promoting and making lifestyle medicine accessible?
I think we have to let everyone know it's available. And you have to be able to put it everywhere, whether it is in an underserved population or the population who has the means to access it. And so some of the work that I have done that I have been most proud of and intrigued by and wowed by was the ability to take a space where we have patients in the food pantry, where they're getting their food baskets, and they don't know what to do with their food. So we have a team of boots on the ground in the space, helping them to take their food pantry items and creating a Nourish Bowl. And then we have patients who don't have access for transportation, virtually coming in from their homes, where we have sent the food out via Instacart to their homes, and we all cook along together and have teaching programs. We have our medical students, our residents, our dietitians coming in and really, educating. I am virtual the majority of the time because I can't be everywhere, but this allows us to put that into our residency training because we have all these different sites across the state of Pennsylvania where they can chime in as well and have physical locations in their residency site and virtual locations out to their patients who cannot come in. So then we're looking at the social determinants of health, right? We're really looking at all of the different barriers and struggles that patients may have, and we're really just knocking them down by leaning into our virtual spaces, our in-person spaces. The in-person spaces are important for connection purposes. The virtual spaces where we come in and shared medical appointments are important for preventing social isolation and loneliness and all of that. So I think just thinking outside of the box, and also listening to these success stories. We have a wonderful success story of a patient who lost 150 pounds by the shared medical appointments of lifestyle medicine. And she wanted to tell her story. She's very proud of herself, as well she should be. And she went on the news and told her story, which then improved awareness that this is open to anyone who wants to participate in these shared medical appointments and start to get the tools they need to care for themselves.
Great. I remember some of those powerful stories from many of my patients that really became viral YouTube stories. So yes, those are powerful stories and they're worth sharing. I really admire your work on employee wellness programs. Can you please share how have you been engaging with health plans and employee health to create a culture of wellness within your organizations?
So we have our own health plan, the UPMC health plan, and we also have a physician who is employed by the health plan who is lifestyle medicine board certified. And I'm very proud of the fact that we have, a physician who is inside of the health plan and has that desire to keep our members, our employees healthy. So I work very closely with Dr. Suzanne Labriola, who is the physician who is inside of the health plan, really coming together to see how we can create programs for our employees and beyond. And so with our health plan, the lifestyle medicine piece is available to every one of our employees, but then also to patients who don't have UPMC health plan. So whether it be United or Highmark or TRICARE or any other insurance, Medicaid, Medicare, they have access to lifestyle medicine as well. So there is no one that is left out in our system, which was very important to me when I was building the lifestyle medicine program to create access. So our health plan obviously wants to keep our members healthy, our patients, our employees, their families, and I think it's just imperative that we continue to work as a team how we can improve the lives of all of those who work with us, for us, around us, and their families. So it's been very important and powerful in, again, changing the culture at UPMC.
Wow. Thank you, Michelle. Your message has been so powerful, and I really appreciate you taking the time and sharing your expertise and wisdom today. And to our audience, thank you for tuning in to the inaugural episode of Flip Your Script. We hope today's conversation with Dr. Michelle Thompson has inspired you with practical insights into how lifestyle medicine is transforming primary care and empowering both patients and clinicians. If you enjoyed this episode, don't forget to like, subscribe, and leave a comment. Stay connected with us for more episodes featuring clinicians who are rewriting the script on health, one patient at a time. Until next time, take action, make an impact, and keep flipping the script on healthcare. Thank you.